Thank you everyone for joining us and taking an hour out of your day today. You are in the webinar Mass Notification Applications. This is an emergency management webinar for New York City home care providers. I want to say thank you to the team at HCP for helping me. I am Carol Dio, Senior Associate of Public Policy, and I'm joined today by Laura Eric, Vice President of Public Policy, Cynthia Pritchard, Director of Events and Education, who is running the show in the background, and also Dina Collins, Director of Information Systems, who helps us on tech on these things. Unfortunately, Kathy Fabreo, our esteemed president of HCP, could not be here. She is on a master plan for aging meeting this morning. So real quick, here's our agenda for today. We're going to go through some introductions, some housekeeping notes. I'll give you an overview of mass notification systems. We'll talk about essential features that you want to look for if you're shopping around for one of these systems. We'll talk about bonus functionalities. What are the little bells and whistles that you can get in these systems. And then I'm thrilled to have 3 speakers from home care agencies that are going to speak to us about their experience with the system that they use. We'll talk for a minute about some emergency alert subscriptions you can get. We'll leave some time for Q&A, and then we'll talk about the all-important evaluation so that we can figure out what we did right and what we can do better. So first, a few housekeeping notes. You can dial in or use your computer audio. Remember that your computer audio can be affected by your internet connection. Everyone will be muted unless they are speaking, and that helps us avoid background noise if you have a dog or, as I have, a cat getting into the wall in the background today. Questions are welcome. Use the chat box at any time at all. My colleague Laura will be monitoring that chat box and collecting the questions for us as we go. Any direct messages that you send in the chat box, if you send one to a particular speaker, those can be very easily missed in the doings and the goings on in a webinar. So we do not recommend you using that feature. Just send the question to everyone in the room. And those are the ones that we can keep after the close of the webinar in case there are questions we don't get to. If you direct message somebody, those are lost forever. We will be sending the slides and the recording link to all participants. And again, this information also will be posted on our website. Keep in mind that the recording does take a little while to process, so that follow-up email will probably come to you later on today, maybe towards the end of the day. Here's the exciting part. We're going to be using Poll Everywhere for some polling questions. No right or wrong answers. It's just a little interactive piece to keep you engaged. So you can use your smartphone right now and scan this QR code that you see at the bottom of the screen. Or you can, hold on, let me get to there. Or you can text from your smartphone. You dial the number 22333 and type in just what you see there, Carol Dio 549, and that will open up the application on your phone. Alternatively, you can go to a web browser, go to pollev.com/Carol Dio 549. So just take a second, scan that QR code, and you will see the poll open, and that'll be ready to go. You can do that while I'm reading our grant information. This project is supported by the Department of Health and Human Services Administration for Strategic Preparedness and Response. We call them ASPR, under the award number as posted in the slide. The content is solely the responsibility of the authors, does not necessarily represent the official views of HHS or ASPR, or the New York City Department of Health and Mental Hygiene, Office of Emergency Preparedness and Response, who we also thank for involving us in this grant project. There's that QR code for you again. I wish I'd put it on some of the other screens. It will pop up again when we have a question, so no panics. We hope everybody participates. That is not very big. That's their information, not mine. So go to pollev.com if you're joining it on the web. And just like that, our first poll question. Again, the information is right up top. Here's your QR code if you're not there yet. We need to know, do you provide services in one or more of the 5 New York City boroughs? Even if it's just one, you're going to choose A for yes, I provide services in New York City. Otherwise, choose no. or if you represent a state agency or a city agency for emergency preparedness, that'll be C. If you're a partner, such as HCA, one of the other associations, Hip Caney's, you'll choose D, or E, I am in the wrong webinar. So you can go ahead and start logging your answers. We have 17 people so far. Not sure why some stuff's coming up on the screen. 18. Get those answers in. I'll leave it open for about another 30 seconds.
Carol, we currently have 73 on, just so you know.
73 on the webinar. Okay. So these are our results popping in here. Oh, somebody's in the wrong webinar. Oh my goodness. Well, please stay with us anyway. Okay, I'm going to close that poll. And here are our results. 84% of those who responded provide services in New York City. So that is great to hear, because that is why we're here for you. I'm going to do some quick introductions. I already told you who we are from HCP. From New York City DOHMH, we have Fidel Monroe. She is with the New York City Department of Health and Mental Hygiene, Office of Emergency Preparedness and Response. And I already lost your intro, Fidel. So if you could tell us who you are, and thank you so much for being here real quick.
Hey, good afternoon, everyone. Those of you who haven't virtually met before, I'm Fidel Monroe, and I am the Home Care and Hospice and Palliative Care Liaison for Long-Term Care Emergency Preparedness at the New York City Department of Health and Mental Hygiene. Like Carol said, in the Office of Emergency Preparedness and Response, and that's in the Bureau of Healthcare and Community Readiness. I'm the Senior Program Manager there. And in my bureau, what we do is that we support the New York City healthcare system to respond safely and effectively in emergencies. Today, I'd like to wish each of you a wonderful holiday season and a happy new year. Back to you, Carol.
Thank you, Fidel.
You're
And I
welcome.
also want to give a quick shout out to some of our state partners that are on the call today. Gingy McQueston from Lower Hudson Valley. I will see you tomorrow. And Deanna Radigan from the State Office of Preparedness. We thank you for joining us. I believe Rebecca from HCA is also here. I appreciate you being here. And I'm not sure if I'll give a shout out to Hip Caney's, also hospice. Always welcome to participate in our webinars. So thanks for being here. So just as an overview, push notifications. Most of the things we're going to talk about happen on a cell phone, but just keep in mind that there are other ways that you could get notifications out to your people. We're going to talk today about the who, what, where, when, why, and how of these notifications. So who? Home care, right? Healthcare. We want everybody to be involved. You want to get this out to your workers. The folks that are going to be in charge of these systems are usually your security directors, your emergency managers, incident commanders, management of some sort. We all know in home care that everybody wears a lot of hats, but it's usually an administrator that will be in charge of these products as you put them into use. What are they used for? Anything you want, right? You can use them for any potential event, actual events that are happening. Some people also use them to get out employee messages. Just always keep in mind that the possibility for alert fatigue is very, very, very real. So if you're constantly sending out messages when something super important comes in, folks may not be as responsive because they're so used to getting so many messages. So think of that when you're talking about the what and the where, or the what and the when, excuse me. The where is anywhere you need it to work. You're going to want to make sure your coverage is good. We're going to talk about that a little bit. Why? Kind of self-explanatory. We all need to know what's going on in emergency. And how is exactly what we're here to cover. So here are some examples of different systems that are out there. I know Everbridge is mentioned a lot at the state meetings. Today, we are going to hear from home care providers that use the Access system, HHA Exchange, and Alert Media, I believe is the other one that we're going to hear from. So stay tuned. These are just some examples. There are many, many, many others. There's Calling Post, there's Swift Reach. Some folks even use WhatsApp to get their emergency messages out. You can use a Facebook Messenger group. Just be careful with the security of your information when you're using a public platform like that. So the essential features that you want to look for, you want the system that you use to be quick, you want it to be efficient, secure, and accessible. If you remember nothing else, please remember this. These are the 4 things that you're most concerned with. We're going to dig a little bit deeper into some of these. So the big question's cost. You're going to see cost come up on just about every slide throughout the presentation because it is very important, especially as budgets are tight. The system you use has to be very affordable. Home care does not get any money for emergency preparedness, as you know. So you need to meet the requirements and you need to meet your needs with getting these messages out at a very reasonable cost. You have to think about functionality. What does it do? Does it do what you need it to do? You need to look at the essential features. Has to be able to get to your people. You have to be able to contact people whenever you want, 24/7, things like that. What are the basic things that you need in your system? Bonus features. Does it allow for two-way messaging? Can people get back to you when they've received a message? Does it allow for you to track those responses? Does it allow for you to track messages so that you know what went out at what time? Can you escalate a message? Remember, I talked about alert fatigue is a very real problem. You want to be able to escalate those red alerts, right? Maybe you have an orange, yellow, red kind of system. So you want to be able to escalate. That would be a bonus feature. Can you customize to meet your needs? Can you send a message just to your workers in the field? Can you send a message just to your administrators? So you have to think about what customization is going to be the best for your organization and look at those features when you're shopping around for a product. Response capability and capacity. Is it going to grow with you as your business grows? If you have 100 workers today, but you have 1,000 workers next year, are you going to be able to use that same system? So what is the capacity of the tool that you're using? Here are a whole bunch of other things to consider. Is it user-friendly? Can you connect even if a wireless network is down, right? When Wi-Fi goes down, how are you going to reach folks with this tool? Does it integrate with other systems that you use? I think we're going to hear from somebody today that uses their system, it integrates with their scheduling. So we'll hear about that. Again, look at that. Cost is on the screen again. What device are you going to use for this system? Is it going to be a separate device or are folks going to just use their own cell phone? And who's going to maintain the database? Is the vendor going to do that for you? Do you just send them a list of new employees and they upload it? Or do you need someone at your organization to be in charge of that and to do it in a timely fashion? We don't have a lot of extra minutes in our day to do these things, so that's something else to think about. Just when you thought I was done, there's more stuff to consider. Is your message going to go out in real time? Is there a delay? I know sometimes email systems, because of security, you will not get an email instantaneously. So you need to know in an emergency situation that folks are getting this message as quickly as possible. One other thing on this slide I wanted to know is conference calling. Do you have the ability in an emergency to hit a button and be able to conference in your main people to talk to, like your incident command team? And again, no per message cost, right? You do not want to be paying every time you send a message. Just when you thought I was done, you can take this slide home with you. Here is a whole bunch of other stuff that you can consider when you're looking at a system to use. The escalation we talked about. Do you have to message everybody or can you have groups? Like I said, do you need encryption? Are you going to use this for patients? You might need an encryption feature if you're transmitting protected health information. So keep HIPAA in mind, keep employee privacy in mind at all times, but also you want to be able to get that message out in an emergency or a situation. We are going to hear now from Annette if she's ready. Annette, are you?
I am
You
ready.
are. Okay.
Yes.
Let me give you a little intro here. Annette Horvath is a registered nurse. She has over 25 years of experience in the healthcare industry. Annette is heavily involved in emergency management at her agency, Able Body Home Care, and has represented the home care sector by participating in incident activities with the New York State Office of Emergency Management, New York State Department of Health, various committees, and clinical advisory boards. She's going to talk to us a few minutes about the service that she uses with HHA Exchange for her mass notifications. Take it away, Annette.
Good afternoon, everybody, and thank you all for joining. So, when Carol came to me, I looked at the system that we currently have in place. We use HHA Exchange as our software. And with regards to cost, they have a feature where we can send out mass messages to our staff through the HHA Exchange app. And we've maximized the functionality of that broadcast messaging to make it usable so the system, you could send out a broadcast message, we have a case open. That's many of the computer softwares do that, but we wanted it to be incorporated for our emergency preparedness. Initially, the cost was, it came with the system, but as they've upgraded HHA Exchange, there's now a cost to do the broadcast messages. However, we feel that the time that you use it, because we truly use it for two purposes, about open cases and for emergency disaster, that the cost was part of doing business. So we felt that that was, important to us. The reason we like it is the functionality of it. It's very easy to use. It goes through our computer system. If the computer in the office is down, you can actually log into HHA on a cell phone and do it that way. We have the ability to modify and customize the emergency broadcast so that we can do it by language. So for us, we have a large Spanish-speaking population. So we actually created a text message that, this is an emergency. We're activating our emergency drill. And if it's an issue to you and your patient immediately, you'll be receiving a call. Otherwise, this is informational so that you can be prepared. And it's very nice because we can send it in Spanish, we send it in English, we have it saved. So whoever is on call can actually, they're not typing something, the message is already prepared for them. They're just attaching it. They can select the number of employees. It can be all employees. We can select it by language, so we don't have to manually pick who the Spanish employees are, because we've updated their profiles to say if they're Spanish speaking, so they get it. So like somebody like me, my profile says Spanish and English because I want both notifications when they go out so that I know they went out. So I'll get the notification in Spanish and then I'll get the notification in English to my cell phone. It really is a great way to reach out to staff. It does not allow the staff to reply back. This is informational going out. We want them to be aware. We can customize. Should we need to do it for more specific things? We utilize this during COVID when the office was closed, which was a little different. We used it to alert staff of supply days when we would open the office to distribute PPE. So there were a lot of that was like a bonus for us to be able to do that as opposed to just an emergency situation. The system is very easy to use. It's user friendly. It doesn't take a lot of issues to set it up. And in terms of a backup, if there's no computers and no phones, what we do is we have, every week we have a printed census with our printed emergency plan attached. So every Friday when the office shuts down, whoever's on call takes that printed list. It has the patient's name, patient's phone number, emergency contact, whether or not they need electricity, all the things you have to report on in an emergency disaster, as well as a list of the aides, their addresses, and phone number, so that we can cross-reference. So let's say, like yesterday, there was a building collapse in the Bronx, and if we had patients in that area, we could zone aides that live in that area to go there. We could do that from paper, or we could do that from our computer system. Let me see. Am I missing anything, Carol?
No, I think you covered a lot. I love the dual language capability.
Mm-hmm.
Do we have any questions in the chat, Laura, for Annette, or do you
We
have any?
do, and this may be a broader question, but the question was, there was a JACHO audit, and
Jacob.
they said that they have to have a backup system in case cell phones are affected by the emergency. The auditor's suggestion was walkie-talkies. Are there any other suggestions?
So you could not possibly have walkie-talkies for all your field staff. For your administrative staff, I guess that's a possibility. With cell service, you could have landlines, but many people don't anymore. It's a difficult presentation. Joint Commission does say they need a cell phone. There has to be a plan for without a cell phone, but the reality is the features for that are getting smaller and smaller. 90% patients don't have landlines anymore. They're using cell phones. And I think the backup plan is really that you have the availability to mobilize staff if you have a printed report with addresses, phone numbers. I'm not sure that walkie-talkies is a feasible plan if you have like 100 patients, and we have over 500 home health aides. I couldn't buy 500 walkie-talkies.
That's for sure.
But the functionality of the system we use, even if there was no internet access at the moment I was sending it, I can send it, and once the system comes up, it will send. I don't know if that answers your question. I don't think I can solve your Joint Commission problem.
Are there any other questions before we move on to our next speaker? We have a minute. Other questions, Laura?
I'm not seeing anything else.
I
in the
believe,
chat
oh,
box.
I believe that the, your fax, wherever your fax lines are connected to, those are landlines in most facilities. So if you have an old fashioned telephone, you can plug it in there.
Right. That's
Right.
a great suggestion.
Yeah.
Yeah, we actually do have an old an old telephone, like a trim phone, I think it's called, that we keep in the office in a drawer. But
Yeah.
when you're not in the office, I was thinking of it after hours or weekends. Other than that printed list, I don't know how you would manage. My office staff don't have home phones.
So I am seeing in chat just some information sharing between providers, which is wonderful. I don't see any specific questions at this point.
Okay,
All right,
thanks.
well, thanks,
We're
everyone.
gonna go on to our next speaker. She is so busy, she's on the road. So she has called in. I think, Cynthia, you can unmute her.
I
We-
clicked on it. Carla, can you answer?
Hi, can you guys hear
There
me?
she is. There she is.
Oh, thank you.
Do a little intro here, and then we're gonna let you tell us about your system. So on the phone with us today, we have Carla Holub Tarantino. She is a co-owner at Select Care Home Care Services, which is a licensed home care services agency providing care in the 5 boroughs of New York City. From Hurricane Gloria in 1985 to the COVID-19 pandemic, Select Care has continuously improved its response to disruptions in communication and other vital components of healthcare operations. And she is going to talk to us about the system she uses, which is Access. Take it away.
Thanks, Carol. So Select Care is a very small agency. We have about 49 clients and 100 caregivers. In 2017, we changed our scheduling program to a cloud-based program called Access, AXIS, out of Waco, Texas. And one of the things that we looked at was the mass notification and the messaging. Primarily, Access put it in there to reach out to caregivers. We also switched that up so that we could do mass notification in the event of emergencies. It is easy to use for non-tech people. We had to practice quite a bit and get everyone comfortable with using that. And I think that getting people to be comfortable and knowing when to access your mass notification is really, really important. In our organization, the service coordinators, the nursing staff, myself, and the director of nurses are the main people who know how to use this. On the back end, we have a compliance coordinator and a person in accounting that also are able to knock out some messages. Each of us has a plan book with templates of what would we send out in the event of. And if you create a template that you can cut and paste, you're sending the same message out that's already been approved by the administrators. And that is really important because you can do it quickly and it's almost like a non-syncing situation. Carol, you mentioned something which was message fatigue.
Yeah.
Oh man, when we first got this program, we were sending out messages like once a day, and just to try it out, and it was a new toy almost. We realized that people were not paying attention, so we have backed off. We have 2 or 3 messages that go out on a monthly basis. One is a recruitment, one is specifically for mask mandates, and one is if there was to test their own emergency plans. So those three messages go out monthly and they can be scheduled. The program can delineate between nurses, home health aides, clients, administrators only. It has a button you can press for email and or text messaging. It does have a capacity. Whoever the sender is has a capacity to receive messages. We tested that out. The bonus feature is, well, there really isn't a bonus feature because it's right in there. But the one thing that we have to remind ourselves to do, and there are 2 people that update the caregiver side. So if you've add caregivers to your staff, you have to redo the group that you're sending it to. Does that make sense? You manually have to update each group. You don't want to send recruitment messages out to people who are no longer on your active roster. So identifying 2 to 3 people who know that before a message gets sent out on a weekly basis, we always have to go back and look at our, who's been actually in that group. The cost of it was basically already built into our program. There's with Access Care, there's a $420 a month for the service itself, and then you add on $10 a month per client. It's not per employee, but it's per client. So for our small organization, it works. There's not a lot of massaging that program. You get what you get, and then you have to figure out how you're going to work within that program. The other thing that we do as a backup, we also have an on-call coordinator who has a fax, paper and pen. Clients get client information, goes down to her. The caregiver information goes down to her. So, and she's out of the city. So if everything falls out of, falls apart in New York City, we have two people, the coordinator and a backup person who are out of the city who can send out messages, receive messages. And I think if you're thinking about redundancy, that's something that you really need to look at is who has the ability to put in the messages, who has the ability to follow up if the first tier group is unavailable or if the internet goes down. Our other backup is MailChimp. We send out to our caregivers on a monthly basis a newsletter. So they get a newsletter by their regular email. They get a newsletter by MailChimp and one in their envelope. So we do all of our messaging by paper and pen, MailChimp, and emails and texts.
That's great.
So that's
I love-
basically what we do.
Oh, I'm sorry.
No, that's it.
I love the way you brought up redundancy because I did not capture that
Mhm.
on any of these functionalities on the slide. So that's super, super important. Do we have any questions, Laura, for Carla?
So far, I do not see any additional questions.
Do you want to know where I am?
Yes,
I'm in I'm in South Somerset, Pennsylvania, on the turnpike in
Well-
snow.
Well, I thank you for being so dedicated to this project that you were willing to call in despite your trip. Thank you so much, Carla. And you're staying on the line in case we have questions at the end.
Yes.
Okay, thank you, Carla.
And we do actually have a question, Carol. The question is, the plans rely on phone and internet. Any suggestions for what one does if those are not available?
Oh, phone and
Uh,
you said the
it-
plan.
if I could answer that, with us, we have, if our internet goes down in the city, we can communicate with our on-call coordinator we have two things going on. We have our on-call coordinator who lives out of state, who is able to communicate with staff. We also have in our phone system, I can text my phone IT guys, and they can actually move our phones straight over to our on-call coordinator, so she can pick up. So
That's great.
that again is redundancy, but you really have to work closely with your IT guys to figure out how you can move it with them. It's basically a text to one or two people, and within 5 to 10 minutes, it's moved over.
Wow. That's really great. Good question. And when you say plans, you were talking about emergency plans. My head went to insurance plans, so thank you for understanding the question, Carla. We're gonna bring up our third and final home care provider speaker for you today. Lauren Campbell, are you ready?
I'm ready.
Okay. Lauren Campbell is the Director of Emergency Management and Employee Safety for VNS Health, where she provides oversight and support for day-to-day as well as long-range development. She also provides training and implementation of related tactical and operational department initiatives. And Lauren is here to talk to us about the service her organization uses, which is Alert Media.
Well, thank you, everybody. Happy to be here to share information, especially how using the mass notification system aligns with our emergency management plan, as stated from the last questionnaire attendee, and also provides a resource towards employee safety, because it's both of the hats that I'm wearing right now. So yeah, we use Alert Media as our mass notification system. We found it to be very cost effective because virtually it just saves a lot of time. The feature provides us with the ability to send out urgent or emergency notifications in a timely manner to all or specific staff, like some of our presenters mentioned. It is our primary emergency notification system. We do have other systems that have the ability to send out text, but for emergency management purposes, we use Alert Media, in addition to our other alternate ways of sending out emails should something go down. Is part of our business continuity plans, the whole what if this shut down, what will you do, based on certain timeframes. The cost is kind of based on the size of your organization, based on the profiles, the numbers of people that you will be uploading into the system, as well as we do pay for a large capacity of text. Other than that, emails and voice messaging is part of the package, part of our contract. In terms of functionality, it is super easy to use, as Carol stated with her system. Very simple. It comes with templates. We use it to monitor for significant and high risk events within all of our regional service areas. We cover New York City as well as Westchester, Nassau County, Long Island. And so we go through their threat analysis to see what's going to impact our operations. And then that'll help us determine whether we're going to have to prepare for something or activate our emergency plan with the relevant incident response guys. We're able to send out notifications, whether by email, text, voice messaging, and those who are registered into the app, we can send it directly to their either work cell phones or their personal cell phones. There are various ways, like I mentioned, to send out the messages. We can send a direct notification that doesn't require response. We can send out messages that prompts you to press 1 to confirm. Then there are various messages that we can create where the staff can select a certain response. Are you safe? Are you not safe? Do you need help? And then we can work with those specific employees who need our direct response. And we then also have the ability to monitor threats and events all around the United States, because we have staff who work remotely. So we can send out safety checks to some of our staff where an event may impact them directly because the system pings where they reside. And a couple times we did that. The staff were very, very happy and appreciated our concern directly where they were working. Now, in terms of interconnectivity, we're able to integrate our personnel systems to update automatically day to day each day through Workday that we use, as well as we use HHA Exchange for our Lixa. So each day we're able to send current information into the system. That's very helpful to make sure that things are current, and we are communicating to active staff to the best ways that they want us to communicate to them. In terms of essential and bonus features, again, I mentioned the threat analysis, monitoring, as well as the broad range of notification features that's part of this package. But 2 bonus features that we use is the safety monitoring feature, which is a that's provided to our clinical staff who provide in-person services to our members. What it is a 24/7 support where the clinician has a timer session to monitor the time of their work. And it's installed on their cell phone. And should something happen and there's an alarm that is directly connected to the Alert Media Command Center. So they'll reach out to the staff person to see if they're okay. And if they do not respond, they'll directly call law enforcement on their behalf based on the location that that clinical field person entered into the session. In addition to that session, there's a panic alarm. So if for life-threatening events, this person or the clinician can press the panic alarm, which again goes directly to that command center, and they will either simultaneously, the command center will simultaneously call the patient or call the employee, as well as contact 911 on behalf of that staff person. And then later on, they will contact myself and some other listed emergency personnel to let us know that something occurred with our staff. So that's one feature that we had to pay an additional amount for. We find it that staff are reassured about employee safety, which is a common and increased threat right now. Another feature that we use that's a bonus feature is called the analyst chat. We see a lot of things happening around the United States as well as local. So we can have the ability to chat further with one of their analysts who are experienced law enforcement personnel to get updates on certain events that may have an impact on our operation. That again was an additional cost, but as we had the ability to use it and found it to be very effective in updating our staff on very serious matters. We tend to hone in on crime and severe weather updates that cause a concern to our operations. Now, in terms of customization,
We
it's
have
very
about another minute.
Okay, another similar to the other groups, we can create groups, we can create templates. We have done so. We've also used this to train other leaders within our program to highlight specific groups and to send out urgent information to their staff. We're able to collect data on everything we send out, whether we reach personnel in a certain amount of time, to hone in to those who did not respond so that we can concentrate on those staff who need to be checked upon. Other than that, pros and cons to use again. Really don't have any cons about it because, again, it's a safety feature and helps with our communication plans.
Yeah, and I love the whole system you described of checking on the clinicians and having a panic button for them. And I just wonder if all of these features that you're reaching out to employees to check on them in an emergency, yeah, I bet that helps with retention.
It is. It does help the comfort level. It
That
does.
cares enough to check on you, right?
Yes. Yes.
Yeah, that's great. Do we have any questions for Lauren in the chat, Laura?
We do. There's a really great question that says most of the notification systems are really designed to reach out quickly to staff. What about contact with consumers? Do the field staff send out messages to their assigned cases, or does someone else do that?
Excellent question.
We have a different method to sending out messages to our consumers in order to ensure that we're PHI and staying within our HIPAA realms. We do not use the alert notification for patients unless super approved by even our CEO to get the okay for that. If not, we would use a different method to communicate out to members and patients. Most of the time it's through the programs, and we have business continuity plans, which emphasizes what do you do when we activate to get the word out to your patients, and they have assigned personnel to do just that based on their TALs, their acuity levels. So you should work that into your business continuity plans or your emergency plans on who's doing what when you activate to get the word out. It can also be general notifications via social media, but it shouldn't be in your communications section of your emergency plan.
Great. Annette, do you have anything to add about whether you use your system for patients or if you have another system that you use? And then Carla.
No,
would-
I don't. I don't use it for patients due to the HIPAA compliance concerns.
Okay. And Carla?
We don't use it for clients. We have another system where our clients, according to their levels of priority, are communicated with by the nursing supervisors as to what's going on, what needs to be done. And if we have a client who is unable to understand, then we go straight to their responsible parties. So I think the one thing that's very important here is whatever your message is going to be, make sure that it is clear and concise, and you're speaking, especially with the clients and caregivers, it looks as though you're speaking with one voice. So you have to have that consistency in your messaging. That's the one. The other thing I just want to bring up is teaching caregivers to understand your emergency system, how to respond to that system, and what to continue to reteach and ensure that they understand what type of what your actual emergency plan is. Because if the internet goes down and you can't reach them, then your caregivers need to understand what that client's plan is, what are they going to do, and what are they going to do until they can reach somebody in the office.
Yep.
So that's a really, really big part of the mass notification and emergency planning.
Absolutely. Training and retraining is so important, especially if you change your system or you have a system upgrade or you add one of these features. Training definitely always comes into play. One thing I did want to say to the person who asked the question, and we're talking about, not using these systems for consumers, and I keep hearing PHI and HIPAA come up. I will qualify this by saying I am absolutely not a lawyer, but a message saying there is an emergency going out to one way to a patient is in no way a HIPAA violation. You're just alerting your client that something is going on, maybe telling them call their caregiver, or have their significant person call the office, something like that. A one way from your office to the client with an emergency alert would not be a HIPAA violation. Of course, check with your counsel. But I've done a lot of HIPAA work, and that's a one way. You're not collecting anything from them. So we're going to move on a little bit. We only have a few more minutes. Thank you, ladies, for sharing your experience with us.
Carol, if you'll let me jump in for a moment, we did have one quick follow-up from Maggie, who wants to know, are there any suggestions for how you prepare consumers for emergencies? And Lauren has already graciously offered to field that question.
Okay, briefly, because we could do a whole webinar on that, right? So briefly.
Yeah, it's briefly, and it's part of the regulations to have the individual emergency plan for your client. We have just a form that breaks down what emergencies are, what they should have. Our caregivers and our home care RNs will go over the plan with the client and maybe household people or family members. It describes what you should have for 2 weeks, how to create a go bag, and if you are in an evacuation zone, and it provides a list of various numbers that they should have. It's a triplicate form. It's hard copy. So I think it's a really good plan to have for not just your clients, but also for your family as well.
Great, thank you. And you've given me an idea for a future webinar, so thank you, Maggie, for asking the question. Real quick, I just want to make sure you all are aware of the alert services that you can sign up for so that you can get all the alerts that matter to you. Most of you are probably familiar with New York Alert, which provides citizens. You can give this information to your staff, to your clients. Anybody can sign up for this. You do not have to be in emergency management. You'll get critical information on what's happening in your area. You can get that information by phone, email, text, fax. You can sign up for what you want to hear about and what you don't want to hear about. It's really a great tool, and that's provided by New York State. There is also Notify New York City, which is New York City, based, of course. Alerts City Services. This is an app. It's not a sign up on a webpage. It's an app. It's available for iPhone and for Android. You can put in up to 5 addresses or cross streets to get notifications about. So if you have, you know, your staff person has their home and they also have their client's home, but they also have their children's school that they want to know what's going on at their children's school. You can put in up to 5 addresses into Notify New York City, and they'll provide you with missing persons reports. They also have basement alerts for folks that live in basements if there's going to be a flooding situation. Planned events will have a notice go out so that you know if you need to avoid a certain area because there's going to be a parade, for instance. Police notices, transit disruptions, public health notifications, parking, weather, even beach information you can get on Notify New York City. So that's pretty cool. And finally, there's the National Weather Service wireless emergency alerts. That comes through as a text on your cell phone. You will know that it's from them because there's a special tone and a special vibration that comes through on your phone. It's available in English and Spanish, and that service uses the location of the device that you have it programmed to check for you. You'll get extreme weather. You'll also get local emergencies that require immediate action. Even amber alerts, blue alerts will be on there. And if there's a national emergency, presidential alerts will come through that service as well. So do we have any other questions before we go to our final poll question, which I know is going to work?
We currently have no questions.
Okay, thanks, Laura. So go back to your poll spot on your device or wherever you're getting into the polls. And we would like to know, because of what you learned today, what do you plan to do? You can choose 2 of these. I probably wish I had allowed you to choose all of them. But are you going to look into a mass notification system because you don't have one? Are you going to upgrade, change to a new system, sign up for some of these alerts, or you're not a provider and you don't get to play with these systems? We have a lot of people that are going to sign up for alerts, it looks like. And about a quarter of you are looking at new systems or upgrading. We're going to leave this up for a minute. A lot of people signing up for those alerts. Give it another few seconds. Thank you guys for playing with our poll. We're going to lock it out now. And it looks like over 40% are going to sign up for alerts, which is great. And some of you are going to look into a new system or an upgrade, so that's fantastic. Do we have any final questions for either our panelists or me, or hopefully in your evaluation, which I know you will do post haste? Here is the QR code you can scan with your smartphone, or the link is there for you to the SurveyMonkey evaluation. We want to hear how you felt about this webinar. We want to know if it was helpful. We want to know if you want to know more about this topic, if you want to know more about another topic. This programming is grant funded, taxpayer dollars, so it is for you, and we need to give you what you want. So here you have my contact information, and you can scan the code from there. I'm going to switch slides, but the code will stay. And I want to say thank you to our speakers. Thank you to our city and state partners on the line with us, especially New York City, who's responsible for this particular grant funding. And remember, the recording and the slides will be sent to you. They will also be posted on the website. You'll get a little reminder to do the evaluation in that follow-up email if you've already done it. Don't worry about that. May take a little while for this recording, so just be patient. If you don't get it later today, I'm sure you will have it by tomorrow. So if you click that QR code, you'll have that link. You can get the evaluation. I always find it's best to just get it out of the way. right away.
And
So-
Carol, we do not have any further questions,
Okay.
just some complimentary and gracious comments.
Okay, I'm gonna open up the chat so I can see some of them. This is great. I think somebody that doesn't use QR codes, and I feel your pain because I had my phone for about 10 years and I thought it was me. And it turns out my phone was so old, it did not know what a QR code was. So there's a link there. So you can just click on that link when you get the email, or you can copy it from the screen. You have some happy holidays. Great. And you can look forward to our next webinar, which will be in the spring. We're looking at recovery topics for you, specific to home care. And we really appreciate, again, New York City's support of home care in the emergency management space, because we are sometimes forgotten about in emergency management. There's no funding and there's not a lot of time, and you all wear a lot of hats. So these gatherings are super important for your education. And we thank you for being here. You can drop off anytime,
Right.
Thank you, Carol. Thank you.
Happy
especially
holidays.
Lauren and Carla and Annette for giving your time so graciously, volunteering to help us out.
My pleasure. Be well. Happy holidays, everybody.
Thank
Same.
you. Enjoy Pennsylvania. I'm sorry, Fidel, I've interrupted you 3 times now. Go.
That's okay. I was saying thank you to the panelists and happy holidays and happy new year to everyone. Thank you so much on behalf of New York City DOHMH. Thank you.
Thank you. We'll talk soon.
Thank you. Take care, everybody. Bye-bye.
Hi, Annette. Thanks again.
Thank you. We're good to sign off. All right.
Stop record.
Stop record.